Hi, today we're just going to go through some exercises that we do post shoulder injury, getting an athlete back to moving well and to getting stronger after injury. This is a pinned external rotation, so we're fixing the elbow against a pole and externally rotating the shoulder, just making sure that it's within any pain range and also that it feels in good control all the way through. This is a slightly resisted abduction exercise of the shoulder, just to the hand inside the pec there, just to give some tactile stimulation of how the shoulder's functioning, especially post-dislocation. So just trying to get the deltoid, posterior deltoid to work as well as the traps or the upper traps. These are one of probably my favourite, like a Scarecrow kind of position, just to focus on improving the strength or the activation of the posterior shoulder, especially post-dislocation or post-AC injury. It's a very simple exercise and remember done within pain ranges. This is a seated thoracic extension, so the bar there you can see just goes either at or just below this level of the scapula or the shoulder blade. The cue is to tip your head back and to roll back over the bar. Very, very slowly done, and obviously within any pain range. The idea is to increase the extension of the thoracic spine, which helps shoulder function in general. This is kind of a look through thoracic rotation exercise. So the left hand there just holding the bar, and the right hand or the other hand rotating around on the wrist. So it's a nice steady exercise, again within pain ranges and in good control. These exercises are all about trying to get the head to follow the torso so that it's in one line of rotation. It's a really good exercise to start improving thoracic rotation post shoulder injury. So this one here is called a lat depression or scap depression exercise. Just trying to get the lat to fire and some of the muscles that sit in behind the scapula there to get the scapula to sit back or roll back onto the rib cage, and in retraction that's called. So again, within any pain ranges, and it's not a big range of motion as you can see there, so it doesn't have to be a big exercise.